pour accueillir le chef de l'État.
Thank you for standing to welcome the head of state, Mr. Emmanuel Macron. And a round of applause, please, for Emmanuel Macron.
Merci à tous.
Thank you very much indeed. Thank you, everybody. And welcome, Mr. President. Welcome to the WHO Academy. And before we proceed with our opening ceremony, a moment of poetry with a visual artist, Romain Lallière. And I suggest you discover and learn about his universe. Romain, you have the floor. Thank you, Romain. Thank you. Building a healthier world. Thank you as well to the WHO Academy. And maybe with a little bit of magic, the WHO Academy could draw from that magic. And I suggest now we hear from the WHO Director General for some words of welcome for the Head of State, for our distinguished guests, and for all of the friends following us online. Dr. Tedros, you have the floor.
Thank you very much, Dominique.
Your Excellency, President Macron, Secretary General Louis Mushikiwabo, honorable ministers, leaders of the city, metropole, and region, Excellencies, esteemed guests, dear colleagues and friends. Bonjour à tous.
Good afternoon and welcome to the WHO Academy.
Monsieur le Président, let me begin by expressing my deepest condolences and solidarity with the people of Mayotte after the devastation brought by Cyclone Chido. I thank France for its strong commitment to the success of the WHO Academy, and especially to His Excellency President Macron for his personal engagement and leadership since our very first conversation. I can trace the idea of the WHO Academy back to my time as Minister of Health in Ethiopia, when we wanted to transform the country's health system, and I was looking for guidance on how to do it. It turned out WHO had exactly what I was looking for, but it wasn't WHO that told me about the reform guideline. I only found it by Googling. It was from a Google. My experience is not unique. WHO is known for its world-class technical products, guidelines, norms, and standards. But translating them into real-world action has often been hindered by a lack of institutionalized training. Our products sometimes sit unused on shelves or unopened in email inboxes. While WHO has rich knowledge and expertise, until now we have had no systemic or institutionalized way of sharing it. And so the idea of the WHO Academy was born. Its mission is simple but ambitious: a new institution to equip health and care workers, policymakers, and the WHO workforce with the skills and competencies they need to deliver health for all, including for epidemics, pandemics, and other emerging threats. The Academy is one of more than 50 initiatives in a comprehensive set of reforms that we have been implementing since 2017 to make WHO more effective, efficient, and responsive to the needs, risks, and challenges that countries face. In 2018, during the G20 meeting in Argentina, I had a chance of meeting in a corridor with President Macron and mentioned to him this idea of the WHO Academy. It didn't take more than 2 minutes. And he said, this thing is a very important project, and we cannot discuss it in a corridor. So we'd be happy to invite you to Élysée, to Paris, and let's discuss this thing really seriously. And I was so, what do you call it? Maybe joy is less of an expression, actually. But I could see his commitment and his support from that day. Then in 2019, fast forward, we signed a letter of intent to establish it in Lyon. In 2021, we broke ground, and today we open the doors of the WHO Academy together. I thank the region of Auvergne-Rhône-Alpes, Aurigno. The metropolis of Lyon, the city of Lyon, and the government of France for their support in the construction of this stunning building. I saw actually firsthand the alignment and the bipartisan position from federal up to the mayor, everybody working hand in hand to make this a reality. Thanks also to our generous donors and to the more than 30 countries that have joined the Academy group of friends, which was founded by France, Indonesia, Japan, Rwanda, and Qatar at their last World Health Assembly. The WHO Academy will create high-quality, learner-oriented courses based on the priorities of WHO and our member states. It will build a global learning ecosystem that promotes lifelong learning practices at WHO and across the health sector. It will develop and disseminate quality standards in health education. By 2018, the Academy aims to train 3 million health workers worldwide. Here in Lyon, the primary focus of the WHO Academy campus will be on training of trainers and policymakers from all corners of the world. The Academy will deploy cutting-edge technology, such as world-class simulation center that replicates real-world situations, an emergency operations center training room to learn and share good practice on emergency management, and virtual reality tools for an immersive experience. But the role of the Academy won't be limited in its activities in Lyon. We want the Academy to be accessible to health workers in every corner of the world. It will offer an online learning platform with free access to world-class courses on priority health topics. We can send Lyon to every corner. Designed with a focus on inclusion and accessibility, the platform will reflect our commitment to empowering learners from diverse linguistic and cultural backgrounds. The Academy opens today, but its work has already started. More than 5,000 learners from 172 countries have already registered in the learning platform, accessing the first 37 courses. Hundreds of additional courses will be soon hosted on the platform in the 6 WHO official languages and many more. In-person workshops have already been delivered in Lyon and in the field, including in Africa, for 8 countries. Your Excellency, Mr. President, dear colleagues and friends, the Academy cannot succeed alone. Developing such a unique learning ecosystem requires partnerships and collaboration. Your support will enable the WHO Academy to drive lifelong learning in health as a global priority. Together, we can shape the world's first global health learning hub and contribute to WHO's objective of saving 40 million lives over the next 4 years. Your investment in the WHO Academy is an investment in equity, health, and education. But ultimately, it's an investment in people for a healthier, safer, fairer future for all. And before I close, once again, Your Excellency, Mr. President, my deepest respect and appreciation for your leadership in realizing this great project that will be a game changer in global health. Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. President.
Thank you, Dr. Tedros. Merci pour ce message qui...
Thank you, Dr. Tedros, for this message, which reminds us of the mission and the ambition of this WHO Academy, which is designed to support countries all over the world. And these training programs will be delivered in all languages, including French, and including this exercise, which is to try to praise the Francophonie, but also multilingualism at the same time. I'd like to welcome the Secretary General of the Francophonie, Ms. Louise Mushiki-Wabu. Thank you very much indeed. Dear Dominique, thank you. President of the Republic, WHO Director General, distinguished ministers, director of the regions, director of WHO Academy, Your Excellencies, ladies and gentlemen, distinguished participants, I'm delighted and honored as Secretary General of the Francophonie to be associated with this opening of the WHO Academy campus. We were here 3 years ago, in 2021, to see the launching of the construction of this wonderful building, and we are here today to celebrate the Academy, which is now up and running. We're gathered here at the very heart of multilateralism and universalism and knowledge in the health field. And I'm here as Secretary General of La Francophonie because the OIF wants to work very closely with WHO to ensure that French speakers benefit from the training here among the 3 million Director General. I hope at least 1.5 million will be from the French-speaking world. And the training sessions must also be delivered in French. And I was delighted to see that some courses are already available. We, as La Francophonie, are trying to leverage the power of the French-speaking community, and I'm delighted to see some French-speaking ministers here as well, and hope that they will also play their role to ensure that French speakers benefit from these training programs. You know as well as I do that we are living in a troubled world in search of new solutions, where multilateral institutions are challenged to try to find solutions. And I think this WHO Academy is one of the solutions in this multilateral world. So my warm congratulations to you, Mr. President, first of all, because you were at the very birth of this project. And I'd like to thank the Director General and your team for the determination that you have shown in making this promising project a reality, this global academy. Here we are in Lyon, and it is now possible to train face-to-face or remotely these thousands or even millions of practitioners using state-of-the-art skills and cutting-edge infrastructure. And the OIF, the Francophonie, would very much like to see French speakers benefiting from this cutting-edge training in French, of course. Now, by sharing the experience and knowledge of healthcare professionals from all over the world, disseminating common standards developed within the WHO, and enabling the exchange of experience and sharing of knowledge. The Academy will, I am sure, help to make the world a healthier place, a safer and a more inclusive place. The OIF is associated with this event and this academy through an agreement that has been signed between the OIF and WHO, and my friend Dr. Tedros and myself signed that in Geneva. But I'm here to say that the whole French-speaking family is behind you in this initiative. We will be there to support you so that these training sessions are provided as we all want. I'm here because the heads of state and government of our organization have asked me at the last summit of the Francophonie, presided over by the President of France in Villers-Cotterêts. I've been asked to ensure that our organization is present within this academy and that French speakers can benefit in this linguistic diversity, this multilingualism, which is ever more necessary today. I'm from a country with 4 official languages, and the Minister of Rwanda, I'm sure, agrees that the great reforms that we are carrying out in Rwanda will also benefit the French-speaking population. At the in-camera session at the summit, which focused on the challenges of multilateralism, heads of states underscored this common challenge to train, to educate beyond the realms of the French language, in harmony with other languages. In the declaration of heads of state and government at the summit of the Francophonie, the 93 states and governments of the OIF, we are now the second largest organization in the world after the United Nations. Those 93 heads of state and government called explicitly for a strengthening of Francophone training in the area of health in order to combat pandemics more effectively. And they welcomed as well the support of our organization for the WHO Academy. Allow me to stress something which I'm sure won't come of any surprise to you, because I know how important it is for the success of this project. Cultural and linguistic diversity, which the Director General himself has spoken of. DG, I know, and Academy Director, I know that you also agree with me that we need to reflect the multilingualism of today's world. And of course, French is one of the languages very close to my heart, and it goes well beyond, of course, the borders of France. So the WHO Academy can count on the unconditional support of the Francophonie and the OIF, and the agreement that was signed in 2021 between myself and Dr. Tedros is at the basis of that, bringing our two institutions together. And that will be the basis for our collaboration. And today, more than ever, that is at the forefront of our minds. So, Director General, Dr. Tedros, I assure you that together we need to ensure that this agreement is a success. We will support national and multilateral efforts through our representations in multilateral capitals, our representative in Geneva, who is here in the room today, by the way. We have our headquarters in Geneva and Paris, of course, as organizations, so that will make things even easier in terms of our strong collaboration. And we know that people's well-being depends first and foremost on health and education. So let's work together according to our own respective mandates. Let's create a favorable environment for promoting health and health security by bringing partners together and fostering the emergence of policies, joint programs, and specific strategic interventions in the French-speaking world and beyond. So, you can fully count on the commitment of the Francophonie and its Secretary General. Thank you very much for your attention.
Merci à vous, Madame la
Thank you very much to you, Secretary General of the OIF, the International Organization for Francophonie. And we should remember that it is part of the group of friends of the WHO Academy. To be able to really anchor their full support to this WHO Academy, member states have established a group of friends of the Academy that commits itself to promoting this institution in all ways possible. We will now be listening to Paul Kagame, the President of Rwanda, one of the founding members of this group of friends of the Academy. And he has recorded a message to be broadcast here today for us. Cher Dr Tedros, chers Mesdames et Messieurs, tout d'abord, je voudrais féliciter l'Organisation mondiale de santé ainsi
for inaugurating the WHO Academy. Thank you for the invitation, and I had hoped to be with you in person. To President Macron and France, I thank you for championing this very important initiative. Rwanda fully supports this Center of Excellence. The COVID pandemic showed us the importance of training Africa's health workforce. New health challenges have continued to arise since then. We need to lean into advancements in science and technology and provide better learning opportunities for health professionals. In Rwanda, we aim to quadruple our health workforce in the next 4 years. The WHO Academy will be instrumental in helping us achieve this objective, and we intend to make full use of it. We owe it to our people to deliver consistent, affordable, high-quality health care. And for us, this means creating partnerships where we can benefit from knowledge transfer in essential fields like biotechnology. There is a lot we can do with friends and partners to build on what we have already accomplished. We look forward to witnessing the outcomes of this promising institution, and as always, Rwanda stands to support and do its part. Once again, congratulations.
Thank you very much for this pre-recorded message. Ladies and gentlemen, dear invited guests, we are almost coming to the end of this ceremony, but of course we would not be able to move on to the closing of the ceremony without hearing personally from the person that has advocated personally for this academy to open here in Lyon, and who has made this site part of the French strategy for global health. I would like to please help me in welcoming the President of the French Republic, Emmanuel Macron.
Merci beaucoup.
Thank you very much. Dear Director General, dear Dr. Tedros, dear Madam Secretary General of OIF, dear Louise, ladies and gentlemen, dear ministers, ministers from the entire world, in fact, and ministers that are present in France here today, thank you very much for coming. Dear members of Parliament, dear Madam Vice President of the Regional Council, as well as the President of the City of Lyon, dear Mayor, dear ladies and gentlemen, elected officials, Prefect of the region, ladies and gentlemen, ambassadors, dear ladies and gentlemen, directors, all protocols observed. The health of all peoples is a fundamental condition for global peace. This vision that was inherited to us by predecessors was anchored more than 75 years ago in the Constitution of the World Health Organization. Since then, we have gone through many different challenges, and together we have even had to face certain pandemics, and we still remember this quite vividly. There were conflicts that arose. There were many different national conflicts, blocks against blocks. But if we are gathered here today together, we are here to send out a strong message that we are ready, that we are going to work together. This commitment towards everybody's health, all people's health, and even beyond, and I will come back to this point, is more than ever a fundamental precondition for global peace. Now, dear Dr. Tedros, dear ladies and gentlemen, directors that have come from more than 150 countries where the World Health Organization is present, you embody this ambition, this collective ambition that we all hold. And here I would like to congratulate you on your commitment and congratulate the commitment of scientists, researchers, healthcare workers, directors of all the different research institutions that are here by our side and that are participating in this ambition that we all share. I know that beyond all of these different institutions, research institutions, etc., there are many different issues that are fundamental, such as resources, which is really the cornerstone of these institutions. It is men and women that to make sure that we have high quality healthcare services available around the world. And this is really what is at the heart of this very ambitious project here at the WHO Academy. There are many political authorities that have come from 5 continents that are present here to testify to this. And our role as political deciders and architects of global health is to support and to train healthcare workers. We need to train more healthcare professionals. The WHO has announced a shortfall of 10 million of healthcare workers by 2030. And there are many different conditions around the world for many different reasons. However, we can see that in all regions of the world, there is a shortage in terms of healthcare treatment and services. So I think that this task is extremely important. We need to prepare healthcare personnel. We need to train them better, allow us to deploy all the different scientific discoveries and new technologies. This is really the main objective of this academy, which is at the heart of the mission of the WHO. And I think that I can say that just a few years after the end of the COVID pandemic, this is really at the heart of the ambition that we must continue to work on. This is why, dear Dr. Tedros, I'm very pleased to be by your side today. Just a few days ago, we were celebrating the achievement of an objective that was 5 years old, which was to rebuild Notre-Dame de Paris. Now, this is a commitment that we had made 5 years ago as well, which was to build this academy. It is, in fact, in 2019 that we decided to establish a new institution that would fully embody this ambition, the World Health Organization Academy. Now, 5 years later, here we are, 3 years after the groundbreaking ceremony, and I remember that we were here in Lyon back then with many of you. This magnificent campus has now opened its doors, and I have to say that we really feel a lot of emotion. We are in a temple of knowledge. This is a joint house that is going to help millions of healthcare professionals, but also political leaders and deciders that come from many different health institutions. 4,000 will be trained as of 2025 and 3 million by 2028, as you reminded us. And this will benefit all people's health around the world. Now, during this period, we have learned, and I had the privilege with many of you in confronting the issue of COVID-19, and we were able to tackle it because there were many different scientists that helped us understand it better. There was a world of science that was open to other scientists, and we were able to take some decisions. There are healthcare workers that were present around the world that mobilized to try to gain knowledge and then to disseminate this knowledge, such as diagnostics and tests. We saw how important the organization, the preparation was, and we learned many different lessons that I hope will be translated into reality here in the WHO Academy. First of all, of course, we should not be distracted. One of the objectives at the heart of the WHO and at the heart of our public aid for development, which is the support for primary healthcare structures. We can train and retrain, but if primary healthcare systems are weak or have disappeared or are non-existent, it's very difficult to tackle emergencies, and this is what we saw during COVID. And here I would like to take this opportunity to reaffirm this importance of primary health care. There are many different ministers that are here present today, and there are governments here present, and I would just like to underscore how primary health care is so important. Paul Kagame just mentioned how important this is. He was speaking about long-term investment. He was speaking about making a primary healthcare system much more robust. When it comes to mass vaccination, primary healthcare is extremely important. Now, secondly, it's the One Health approach. Now, this approach is something that has become a reinforced conviction, especially after COVID, and this will be at the heart of the training exercises here. And we saw in the simulation room how important this was. There was a simulation of a zoonotic disease that spoke about the importance in the linkages between human and animal health. We saw the importance of this nexus, and I would like to welcome the presence of many different French research organizations that are here in attendance. The COVID-19 pandemic finally convinced us that this intersection of knowledge was fundamental for tomorrow's health. We have here the Director General of the Animal Health Organization. We also have the WHO, we have the FAO, the UNEP program, as well as all of these different research institutions in CERN, etc. We can see how important this One Health approach is. I have to say that Professor Duplessis for France has shown us the importance of these linkages. So this One Health approach will be at the heart here at the WHO Academy. Now, biomanufacturing is also essential. We need to be able to manufacture medical products, which is very much tied to sovereignty, medical sovereignty. Now, in this building, but that it is accessible to all thanks to its digital platform, we have many different initiatives that will be deployed, and I would like to welcome all the different scientific and academic partners that will be working with the WHO Academy. I won't be able to mention all of them, but Lyon 1, the French Network for Global Health, the WHO hubs, whether they are in Berlin, Seoul, or Nairobi, or universities from the entire world that are helping us with the project from Berlin to Johannesburg, Kigali, Boston, and London, as well as others. We can see that this academy will be the epicenter of a network not only of research and of training in France and in the region, but it will be disseminated throughout the world to maximize synergies. We also must remain on the cutting edge of innovation and accompany the advent of artificial intelligence. This will be translated through adapted training sessions. We must be able to continue working together with all of our partners that want to, especially actors from Lyon, for the WHO Academy to be an incubator for inventive, innovative solutions that can be driven or helped thanks to artificial intelligence. We know that artificial intelligence will be able to help in the healthcare sector, and we are convinced of the importance of digital transformations as well as artificial intelligence in health. These solutions will allow us to increase the capacities for response of healthcare professionals. It will help them make decisions. It will also help find win-win solutions. And I think that all the different actors of artificial intelligence should work in partnership with this academy. This has all been made possible thanks to many of your commitments. Thank you very much for your commitment, for your consistency, and thank you very much for working with the WHO Academy. Dr. Tedros, thank you very much, and thank you very much for having crossed the river and the border. I would also like to thank the City of Lyon, the Mayor's Office of Lyon for their commitment. I would like to thank the region. Thank you very much for your financial support, political support, and the determining role that the municipalities have played since the very beginning. Thank you very much for making sure that the WHO Academy was placed on the global map of world health. Lyon has always been a pole of excellence for health, and we saw that in 2011 thanks to a WHO office and then the International Association for Cancer Research. And I would like to welcome the director as well as the members of staff that are here present. And I think that this was perfectly illustrated during the Global Festival of Health during 10 days that represented this engagement of WHO and Lyon actors in the area of health. I know that this festival underscored the importance of prevention. This academy will anchor all of this legacy, and we hope that we will be able to provide some of this excellency that is a trademark of Lyon. I would also like to thank very generously companies that had the audacity to invest here to make sure that this academy becomes a reality. I would like to really thank Monsieur Ambreux with his company that was able to mobilize a great number of donors, and we would like to thank him for making sure that public-private partnership became a reality. I would particularly like to thank those that were working by his side. We would like to thank Sanofi. We were just a few weeks ago together, Johnson & Johnson, Total, the national company for the Rhône, and the April Group, as well as other companies. Some other companies are thinking about becoming involved in this wonderful project, and I think that this will allow us to go even further. Here we must also mention Pierre Donsberg. Thank you very much, Pierre. Thank you very much for your commitment. We owe a lot to you. And thank you very much to your steadfastness to make sure that you were able to gather resources with great discretion, as always. We would like to thank the private sector. You played a very important fundamental role, and we would like to thank the Ambassador for Global Health, Madame Anne-Claire Amprou, that I would like to warmly thank for her unwavering support that has helped in mobilizing the ecosystem of the public-private partnership at the global level. And through you, I would like to thank the entire network of diplomacy and diplomats that are working to promote the WHO Academy around the world. I would also like to thank the prefect, and I would like to thank the city. I know that throughout these past 5 years you have worked very hard to make sure that that the WHO Academy becomes a reality. I am very proud that France has been able to support this project at the sides of the WHO since the very beginning, and we do have this collective force, and we have been able to bridge the gap of the differences that exist in order to fight together for this common project. Dr. Tedros, you can count on us, and I would like to take this opportunity to announce that we will keep our commitment that has been unprecedented for the past 4 years for the investment round 2025-2028 of the organization. I know that certain doubts have cropped up, and I know that there are many different concerns regarding elections that took place. However, France will be by your side, even though, of course, there is a lot of turmoil, but we will be there. We will stand by you. I know that consistency is a quality because it gives you a certain level of visibility, and I will make sure to be the guarantor of that visibility. For 2025-2028, we will maintain our support. Of course, we cannot be the only funder for the WHO Academy, and it is up to all member states, to all public and private partners to help us with the resources needed to continue the WHO Academy. We will need to have help to continue with our activities. Now, beyond this and beyond the activities of the Academy, our engagement must be resolute, even though there are some changes that are rising around the world. When we are speaking about child vaccination and perhaps some illnesses that could be forgotten, such as polio, but it still has not been eradicated. Let us not forget it. We also should bring up HIV, AIDS, tuberculosis, malaria. We must never give up. Our compass is clear. We must allow every country to be able to treat and help every patient in their country. Vaccines are extremely important as well for health sovereignty. The role of the WHO is very clear, and we support the WHO. We have to reaffirm this here. The WHO must be our collective compass, thanks to recommendations that are evidence-based, that are led by political commitment that must not waver, regardless of the turmoil on the international stage that exists. We are gathered here day together, and we would like to reaffirm how much we need the WHO to guide us during the next pandemics, to lead preventive campaigns that are essential for global health. And I am reiterating this because no fracturing of the international health order and in research would provide any sort of efficiency. And any type of privatization of the management of crises or prevention would take us backwards. And today, more than ever before, in countries where we wouldn't expect there to be, we need to defend open science. We need to have independence in the area of science, and we need to be able to provide the resources to governments to be able to continue with this. We need to have a WHO that is independent, that is fueled thanks to this independent scientific system, and that does not seem to any sort of governmental pressure. If we've learned something from the past, it's that anytime there is a crisis, we need to maintain our diplomatic relations, and we need to have absolute transparency. Now, on this international stage, I wish us to continue with our efforts in clarification, the clarification of the missions of every actor, to make sure that we are as efficient as possible with governmental financial resources, and we need to make sure that we help all of our populations. Health sovereignty is the sovereignty that we believe in, and I will conclude my remarks by mentioning this again. We have this challenge in front of us, and our successive ministers for health, we know how difficult this challenge is. We know that there is a lot of work to be done in terms of prevention, training, in terms of eliminating the bottlenecks in our healthcare systems. There are different priorities that have multiplied in the past few years. For example, mental health. Our societies have this health challenge at the heart of our objectives, and I would like to remind you of our trust, our confidence in our healthcare system and our research system, and the efforts that are so important that must be made in this area. Now, in light of the COVID-19 pandemic, we try to reinforce on our national level and a European level our health sovereignty. Now, this reinforcement of our research, of our healthcare industries, our innovation, we have a France 2030 plan, for instance, but we also have concrete actions. The biocluster of Lyon is a perfect example of this for emerging infectious diseases. We have also looked at critical molecules. This is a perfect example, such as paracetamol, which is being worked on a few kilometers away, and 25 other medicines. We will continue to make sure that we have this research and companies come back to France. There are many people that have forgotten to say that there are shareholders that are foreign but that are welcome here, but nobody had asked themselves the question that for decades we had abandoned the production of paracetamol here in France. I prefer to have a company that produces paracetamol even though there are foreign shareholders. So I know that this was an issue that has come up lately, so we want to make sure that we do produce medicine in our own countries. And I know that there have been controversies, but we shouldn't be listening to these controversies. We need to continue funding research and training. We need to continue funding the deployment of all of our health possibilities and services offers in all the different healthcare institutions. We need to also fight against the medical deserts, as they are called here, and to make sure that we have a healthcare policy that is sovereign. I think that this is absolutely fundamental. And accompanied with an effort in the area of prevention, this will allow our societies to be able to meet their challenges. Now, dear Mr. Director General, I would just like to conclude by thanking you and thanking you for the opening of the Academy and your consistent work when it comes to crises. You started your remarks with the mention of Mayotte, and we are so pleased to be here for the opening of this WHO Academy and for all the different training sessions that will be offered. But at the same time, right now, our citizens are living through the worst days of their life a few kilometers away. I will be going in a few hours' time to Mayotte to help France's citizens. I would like to thank the reactiveness of all the different French state services, as well as the territorial collectivities that have helped our population there in Mayotte. We have deployed a lot of resources, but I would also like to thank you very much for the very good coordination that took place between our Minister for Health and the WHO. Now, whether we are speaking about the prevention of infections, tests, diagnostics, psychological support, there has been a lot of help provided by the WHO. The WHO's help is absolutely fundamental, and I would like to thank you as well as all of the United Nations. We have been able to have a quick support, and thank you very much for the solidarity that you have shown for the repercussions of the cyclone in Mayotte. Dear Director General, dear ladies and gentlemen, today you will have understood we are opening not just a WHO Academy, we are laying the foundations of a new stage in global health. This academy, in my opinion, is a symbol of continuity, hope, and innovation. Continuity because we are consolidating everything that we have learned. We are also speaking about hope because here we are speaking about the capacity to train and retrain and to complete people's training and skills for people that will be able to change the reactiveness of their healthcare systems in countries when it comes to crises. We are also speaking about innovation. Through this academy, we will prepare the world of tomorrow. Thank you very much for having had the will. Thank you very much for having believed in it and for making it possible. Long live the WHO, the WHO Academy, and France as well.
Merci à tous, merci à toutes pour votre intérêt. Merci.
Thank you to everyone for being here. This is the end of this opening ceremony. I'm going to ask for all ministers to join me on stage for the official picture. I'm going to call ministers from Benin, Côte d'Ivoire, Guinea, from Lebanon. Please come join us, ministers of Luxembourg, Rwanda, Senegal, Chad, Ukraine. Would like to invite